Hi, Miss Hopkins. I'm Nurse Daniels. I have a doctor's order to put in a 16 French 10 ml catheter in you today. Is that okay? Yes. All right, can I get your name, date of birth? All right, I got my 2 identifiers. I provided privacy by coming in, closing the door. I've done hand hygiene. All right, Miss Hopkins, are you allergic to any betadine, iodine, or shellfish? No? All right, I'm gonna go ahead and expose you. And you would put this above their stomach, but Miss Hopkins is very small, so I'm just gonna expose her all the way. All right. So then I'm gonna come back over here to my catheter, my sterile catheter, and get it ready. Go this way. All right, so mine is very messed up. So we're just gonna pretend that it's perfect. All right, so you're gonna start with furthest away from you first, then your corners. And with these 1-inch corners, you can move it as long as you don't reach over. And always remember to keep your hands above your waist this entire procedure. Okay. So now that you have that, you go ahead, you set your gloves over here to the side, and then you're gonna take this without it ever hitting you or anything else, and you're gonna set it under Miss Hopkins. All right. And to fix it, you can go around Miss Hopkins' legs. Okay. All right. So now we're gonna come back over here and we're gonna put on our sterile gloves, which you're gonna take and open by these borders. All right. When you flip your hands over like this is how they're gonna go on. So you're gonna pinch it and insert your hand. Which is always hard for me because I have very clammy hands. So I'm gonna get the best I can, which is not gonna be nowhere near perfect. Then I'm gonna put on the other one and fix it. Okay, and that's literally the best I got. I'm gonna put my hands under this, hitchhike this thumb, put my hand in. Okay, also the best I got. So now I can fix it without putting my hands near my wrist. Alright, I got this hand fixed, so now I'm gonna fix this hand, and it's very stuck to me because my hands are sweaty. And then it just blew up like a balloon. Don't know why. Okay. Now that you got your sterile gloves on, you're gonna go back, you're gonna open your betadine strips, throw it away, take your lubricant, put it in the corner of your box if you want to make it easier to keep the catheter in. I'm gonna set this to the side. Okay, let's pretend that didn't happen. I have a very tight workspace right now. Alright, never let this hit you or any of this hit your skin. Alright, trash it. Put the tip of it in the corner where you have your lube. Alright, now you're going to go to your next sterile field. Alright, Miss Hopkins. I'm going to go ahead and do some perineal care. I'm going to do the side furthest away from me first. Throw it away. I'm going to do closest to me next. Throw it away in the middle. I'm going to throw that strip away. All right, now this can go in the trash as well. Okay. Now I'm ready to insert my catheter. All right, Miss Hopkins, I'm gonna need you to bear down. You're gonna feel a slight push or pressure. Okay. All right, I see some urine, so I'm gonna insert 1 to 2 more inches. For a male, you're gonna do 3 to 4. All right. So now that I have that, I'm gonna clamp it down with the hand that I already had in her vagina area. I'm gonna take this, blow the balloon up, get it off. Let's trash that out. All right. So now I've done everything I need to do in my sterile field. I've tugged the balloon, make sure it's in. All right, I'm gonna go wash my hands, get new gloves, come back. I'm gonna put this part on Miss Hopkins' thigh with some tape or a clamp. Clamp it on. Put the bag near the unmovable part of the bed below her so any urine doesn't come back in. All right, and when you're done, you take your hands off, prevent hygiene, and make sure that Miss Hopkins is clean. Provide any perineal care you need to before you do the catheter and after. All right, so you're gonna come back in after you have the doctor's orders, and you're gonna tell her that you have a doctor's orders to do remove the catheter. You're gonna get your name, date of birth again, your identifiers. All right, so you're gonna wash your hands, put on clean gloves. They don't have to be sterile. You're gonna empty out below her. This is hard to do. One moment, I'm having difficulty. Okay, we're gonna sit it right there. Below her, you're gonna empty out the urine into a container or cylinder. Open it, let the urine fill into the container. Close it, put it back. All right, Miss Hopkins, I'm gonna be removing your catheter now. You can hold your breath and you'll feel a slight pull, okay? Alrighty. So at this point, you're gonna note any pus or blood on the tip and make sure that it's still intact, and provide her with perineal care and document it, and that is all.